Recently, Chris and I had a different kind of adventure. This time, it was a medical adventure. It all started about a year ago on December 21st, 2021. It was the night of my work holiday party. I work at a Mexican restaurant and I drank far too much tequila. Our house was undergoing renovations after a flooding incident, so there were workers in my home every day. Well, the day following my bad decisions, I was very hungover. I didn't want to be visible to the workers in my unpleasant state, but I still wanted to hear them if they needed to ask me any questions, so I decided to take a nap in the hallway. I was out of view, but still in earshot. After that nap on the hardwood, for about 4 hours, I began getting severe pains in my hip. I assumed I just slept on it funny, but after about 6 months of hip pain, I finally made an appointment to get it checked out. I got an MRI done, and it showed that I have a bone deformity causing a hip impingement. Essentially, my femur head, which is the ball portion of the hip joint, is an irregular shape and therefore gets caught on the socket portion of my hip. There are a few different treatment options for this. One option is to have surgery where they dislocate your hip and shave down the bone and then pop it back in place. From what I understand, it isn't a very pleasant recovery. Another option is to do physical therapy in hopes of strengthening muscles, as well as steroid injections inside the joint to alleviate some of the pain. The downside to this route is that arthritis is practically inevitable later down the road, many times leading to a full hip replacement. We tried the steroid injection and physical therapy, but since my insurance wouldn't pay for physical therapy, I could only afford one appointment. The needle for the injection was huge. Luckily, I'm not squeamish to needles and found the procedure to be pretty fascinating. Because the injection had to go into the hip joint, the needle needed to be long enough to reach, and the doctor needed to be able to see exactly where they were aiming, so they used an ultrasound machine in order to guide the needle up through the top of my thigh and into the joint. Everyone responds differently to corticosteroid injections. My response was that it made my pain feel worse. So we abandoned that treatment route. But before I could make any more decisions on how I wanted to treat this ailment, I needed to see another doctor about something totally different that was found on my MRI. On the MRI that I got for my hip, they found a large tumor. The tumor was located in my uterus, so I made an appointment with a gynecologist to get it checked out. The doc and I discussed all of my symptoms that I hadn't realized were caused by this tumor, as well as the options that lay before me. I decided that since I knew I never wanted children, and uterine fibroid tumors have a tendency to reoccur, it would be in my best interest to remove the whole shebang. Plans for my hip treatment were put on hold so I could have a hysterectomy. It happened really fast. After that initial visit with my gynecologist, I received a phone call that they could fit my surgery in 3 weeks. I stayed busy working and preparing for my recovery. Then on October 26th, my mother and husband drove me to the hospital. It was a great experience as surgeries go. I enjoyed my nap so much that the nurses had to wake me up from anesthesia because I wouldn't wake up on my own. I guess I just really needed that sleep.
How you feel? Sleep. Good night.
I remember when the nurse woke me up, I felt annoyed, like when your alarm goes off in the morning. I don't remember much more from that first night after surgery, as I was still very much drugged up. I don't remember getting my catheter or breathing tube removed, or put in for that matter, and I don't even remember being wheeled into my large private hospital room. I do recall, however, that Scooby-Doo was on TV. My mother brought me a delicious chocolate milkshake, and that I was told I wouldn't be released until I completed my task list, which consisted of peeing, eating, and getting my pain level at or below a 5. I was also told that I should try to walk around a bit, but seeing as how I could barely keep my eyes open, I ignored that suggestion. I did, however, get a bit competitive with completing my task list, in between my nap breaks, of course. I was determined to get discharged before the sunrise, to which I succeeded. My mom and her pup Parker stayed to help out for the first few days of my recovery. My mom had also gone through the surgery herself, so she knew what to expect. I, on the other hand, was very underinformed and had no clue what this recovery was going to be like. She was a massive help, and I honestly don't know what I would have done without her. Chris was also extremely helpful in taking care of me throughout my entire recovery. He did so much for me and continues to do so. The recovery of a total hysterectomy is pretty weird. All my other organs felt bruised and like they were trying to figure out where they fit in this new space inside my abdomen. I would go days without an appetite, and then other days I couldn't satiate my hunger. I also never realized that essentially every action requires use of your stomach muscles. I couldn't cough, sneeze, or even laugh without fear of popping my stitches and being in severe pain. This means that I was limited in what I could watch on TV, and I also had to be cautious around my husband. If you've met Chris, then you know how hilarious he is, like all of the time. Not to mention, everything is exhausting. Let's just say I napped a lot during my first couple weeks of recovery. Even when my best friend Brooke came to visit, we just laid on the couch. I did attempt to take short walks as suggested by my doctor, but I usually got wiped out pretty quickly. After 2 weeks, I had my first follow-up with my surgeon. My incisions were healing nicely and everything looked good. I was given instructions that I were to continue taking it easy, no lifting or overexerting myself for another 2 weeks. Then I could broaden my scope of capabilities. So at week 4, I started to venture out a bit more. I was still tired all the time, but I was allowed to go back to work on light duty. I was due for my first shift back on Monday, November 28th, but on the Saturday prior, I noticed my bigger incision had some redness and pus. It was clearly infected. My doctor's office was closed until Monday, so I attempted to make a telehealth appointment. I was declined, though, because an infection is too complicated and I needed to be seen physically. I went to an urgent care, but they also turned me away. The doctors wouldn't touch a post-op infection. Monday morning, before work, I walked into my surgeon's office and explained why I was there without an appointment. They saw me right away and prescribed me a couple of oral antibiotics for my seemingly superficial infection. Unfortunately, my pharmacy was super backed up and they weren't able to prepare my prescriptions until Tuesday night. When they were finally ready, a friend picked them up and brought them to me at work so I could start them right away. After a few days of taking the antibiotics, my infection looked to be clearing up. That is, until the following Saturday, on December 3rd, when I spiked a fever and my heart rate soared. I had multiple people tell me to go to the ER, so I did. I had taken Tylenol, so my fever subsided by the time I got to the hospital, but my heart rate clocked in at 154 beats per minute. They took me back to a room and immediately hooked me up to a heart monitor and gave me an IV. I got tested for COVID-19 and the flu. Both were negative. I also had a bunch of blood drawn for various tests and cultures. The tests all came back normal, so the doctor ordered a CT scan. After the CT scan showed no evidence of an abscess or internal infection, the doctor chalked it up to dehydration and sent me home. By the time I got home from the hospital on Saturday night, my fever had spiked again, along with my heart rate. My fever stuck around at 101 degrees for a couple more days, and on day 4 of fevers, Tuesday, December 6th, I went back to the emergency room. We ended up sitting in the waiting room for about 4 hours before being called back. This time I was given a bed in a large shared room. My bed was at the far end, directly underneath the single air vent used to cool the entire room. We waited in there shivering for what felt like forever, as the ER was super busy. I got an EKG due to my elevated heart rate, as well as all the same tests as my last visit. I tested negative for COVID-19 and the flu again, and they took 4 little bottles of blood for cultures and 5 vials of blood for other various tests. They used the same vein for each blood draw and then again for my IV. Needless to say, my vein was angry and extremely sore from being poked so many times. By the time I was told that I would be admitted, my fever had been 102 degrees and my heart rate was 140 beats per minute for hours. I was shaking violently and completely miserable from the air vent blowing directly on me. I met with the internal medicine doctor that I was being admitted to and explained all of my symptoms over the past week. It wasn't until 8 p.m. that they actually had a bed ready for me upstairs, about 10 hours after arriving at the hospital. That first night, despite medications and antibiotics, my fever lasted 12 hours without breaking, 6 of which were at 103 degrees. I had the most severe muscle pains, and I felt like there were needles sticking in my skin all over. My whole body was bright red. I was delirious and moaning in agony. My fever only broke after covering my head, neck, chest, and stomach in ice packs while I ate popsicles. The following morning, I met with another internal medicine doctor as well as an infectious diseases doctor. They diagnosed me with sepsis, but knew there was more to it that they still need to figure out. This was the point at which my mother and father decided to come. My mom drove up from her home in Georgia on Wednesday night, December 7th. My father lives in South Florida, so he booked a flight for Saturday morning. I was on multiple antibiotics, magnesium, fluids, and painkillers, but we were still battling my fever and elevated heart rate. Now I had developed new symptoms. My blood pressure had dropped, I had streaks on my arms, which I was told was called sepsis rash, and on top of that, my left arm and hand had swelled up so bad, it felt like it was going to split open. On December 9th, the swelling ended up spreading to include my entire body. I also got a sunburn-style rash covering everything, including the palms of my hands and bottoms of my feet. It was wild. That was the morning that my doctors told me I was suffering from toxic shock. Apparently, it's super rare. My doctors said that they had studied it in medical school, but had never actually seen it in person. At this point, I had a whole slew of doctors working on my case. My gynecologist, one of the other surgeons that helped perform my hysterectomy, and a third doctor from my gynecologist's office had all come to check on me and join the team. By the end, I had seen a total of 7 different doctors during my stay, not including the emergency room doctors, all of which were very fascinated in my condition. My full body rash, which was caused by the toxic shock, was insanely itchy and caused all my skin to peel. Even my eyelids were peeling. We had to move my IV every couple of days due to my veins blowing or the swelling pushing it out. Well, when we would move the IV, there would be a white mark where the previous IV had been. I also had a white band where I would normally wear my watch. My doctor explained that the rash doesn't affect areas where pressure is applied, or in the case of my watch, where my body is used to there being pressure applied. It's a very fascinating thing to watch occur. Another thing that we were dealing with is the results of my CT scans. They showed that I had fluid in my lungs. I had pneumonitis, which looks like cotton balls filling my lungs. I had swollen lymph nodes, as well as a nodule in my left lung and another in my right breast. All of these things are concerning, but knowing that toxic shock syndrome attacks multiple systems in the body, we were staying positive that they're all just from inflammation caused by the TSS. My liver also suffered massive trauma, and my liver values were extremely high. At one point, I was told that if my liver values didn't come down soon, I would need to be placed on the transplant list. Now, if you don't know what toxic shock syndrome is, it's basically when the bacteria that was in my bloodstream causing sepsis released a toxin. That toxin travels through the blood to all the various systems in the body and wreaks havoc. I was told that the toxins in my blood can make it so the blood tests appear normal, which caused the delay in diagnosis. There are only 3 kinds of bacteria that cause TSS. I had Staphylococcus aureus. It is extremely dangerous, and once I started healing, my doctor placed his hand on my shoulder and told me just how close I had come to dying. It was a pretty jarring realization. I am super grateful to my friends and family for being there for me. I had so many people send snacks, gifts, and well wishes. I am also grateful to my mother for saving my hair. After being stuck in a hospital bed for so long, my very long hair had ended up getting matted. I didn't have the strength to hold my arms up, let alone brush my hair, so I was ready to just shave my head and call it a day. My mom brushed the mats out so I didn't have to shave it. I had to use this breathing doohickey to help with the fluid in my lungs.
You almost made it.
Almost made it. And I was on a bajillion different antibiotics. But finally, after a week of being in the hospital, I was finally getting discharged. I got an echocardiogram to make sure my heart wasn't damaged. My liver values were dropping steadily. I was going to be okay. I got sent home with a few new prescriptions, 2 of which were more antibiotics, and told to resume normal activities as my body allowed. My doc said it would probably take a couple more weeks before I felt normal. After getting home and starting my new prescriptions, I began having an allergic reaction. I got the most intensely itchy hives all over my hands and feet, causing them to swell. It looked like I was wearing a red sock. That's how many hives I had. They just kind of blended together to form a big super hive. I called my doctors and was told that an allergic reaction to a medication can happen anywhere up to 6 weeks later, so we didn't know for sure which medication it was. The risks of not taking the antibiotics were far greater than the risks of continuing to take them and just be itchy, so I added Benadryl, Pepcid, and Claritin to my medication list to help with the scratching. It eventually subsided and all was well. The week following being discharged, I had my 8-week post-op appointment with my gynecologist. Today is my 8-week post-op gynecological visit. It's also my first follow-up since my very scary week-long stay in the hospital. My incisions look great. They're still very tender and some areas are still numb to the touch, but that's all normal and to be expected. I got cleared of all restrictions but was warned to ease back into normal life as my body had been down for so long now due to the complications as well as the initial surgery. I also received an order for a diagnostic mammogram to check on the nodule in my breast and nearby swollen lymph nodes. I just had my 8-week post-op appointment and everything looks great, so yay. However, during my hospital stay, we did find a lump in my breast during a CT scan, so I have to get a mammogram. Trying to make that appointment, but apparently it takes a little while for the order to go through, so I am just kind of waiting right now, which is super awful, but gotta stay positive and hope that everything is fine. A couple days after the post-op doctor's appointment, I had my follow-up with a new primary doctor to essentially check on how I was recovering from the sepsis and toxic shock. We did a few different blood tests to confirm all my levels were within the healthy range, which they are. A couple weeks later, I had my appointment at the breast center for my diagnostic mammogram. The mammogram images showed that the nodule is still present in my right breast, however the lymph nodes are no longer swollen. Good news on the lymph nodes, but we still needed to get further imaging on the nodule. So we did an ultrasound. The radiologist believes the nodule in my breast tissue is actually a calcified lymph node that was affected by tattooing. I was shocked since I've never heard of such a thing. Can getting tattoos cause serious damage to internal structures of my body and cause issues later in life? The answer I received was no. I was told it is completely benign and nothing to worry about. As of now, I still need to find out the results of my echocardiogram, as well as undergo one more CT scan to make sure my lungs are healing properly, and confirm the nodule in my lung is nothing serious. It has been a long and weird road. My symptoms from toxic shock have mostly gone away, but may be present for several years, unfortunately. These symptoms consist of fatigue, muscle weakness causing them to shake, my skin peeling, my hair falling out, as well as others. However frustrating it may be to live with these ongoing symptoms, they're all things that I can live with. It is precisely what I intend to do. Keep on adventuring and laugh knowing that I have really pretty lymph nodes.